When patients can't breathe on their own, this ICU machine takes over, the mechanical ventilator. It is a vital life support machine that provides fully controlled oxygen delivery and ventilation. Used in the ICU, it supports critically ill patients who are unable to maintain adequate breathing independently.
The ventilator ensures effective gas exchange by managing several critical respiratory factors. It precisely controls oxygen concentration, breathing rate, tidal volume, and airway pressure. This mechanism keeps the lungs properly inflated and oxygenates the bloodstream when the body's natural drive fails.
Nurses play a critical role by monitoring ventilator settings and patient ventilator synchrony. We track oxygen saturation closely and work proactively to prevent ventilator-associated complications. Maintaining full control of oxygenation and ventilation is an essential nursing responsibility for patient survival in the ICU.